Okay, this talk is about type 3 diabetes. Type 3 diabetes has been the name given for Alzheimer's by some persons, and it relates to the idea that the same things that cause diabetes can cause dementia. And what it really gets down to is the brain's metabolism of fat and the brain's response to dietary fat. And we'll compare that with glucose. So the big thing to learn out of this lecture is dietary fat causes much more problems than are widely recognized. And if you're trying to protect your brain, this can be helpful to you to understand this. Okay, so this picture right here is a coronal image, so a frontal view of the brain. So this is the right side of the brain, the left side of the brain. With looking at any CAT scan or MRI, it's always as if the patient's feet were towards you. So this is the right side of the brain. Here is the temporal lobe, the medial temporal lobe. This is the hippocampus. And for the hippocampus, these are called the cornua amnon 1. So CA1 is how it's abbreviated. That part of the brain is very important for memory, and it's also very, very sensitive to loss of oxygen or loss of glucose. So they're vulnerable neurons to being deprived of blood flow or glucose. So that's a big deal. You lose those neurons, you become demented if you lose them bilaterally. Okay, I outlined the brain in gray for the gray matter. That's where the nuclei are, the cell bodies of the axons, the neurons. The cortex means in Latin bark, like the bark of a tree, and so it's all around the periphery of the brain. In my opinion, that's because it tends to heat up and the cerebrospinal fluid around it cools it off, as well as its waste products can be excreted partially into the cerebrospinal fluid, the CSF. Okay, here's another key picture for this talk to remember. Here's the blood-brain barrier. The body has to have a blood-brain barrier between the blood vessels, the rest of the body, and the brain, because neurons can only function with a precise external milieu, meaning that the concentration of ions must be kept constant for the neurons to be able to communicate and fire and function adequately. So you can't have these big swooping increases in blood glucose and fats and all these other chemicals in the blood like the rest of the body has, because that would destroy neuronal function. So the blood-brain barrier consists of your endothelial cells, arterial lining cells, and they've got tight junctions between each other. And there's something called pericytes, contractile cells, but the money here is that glucose has to get to the brain. It has to cross the blood-brain barrier. So it crosses the blood-brain barrier through what are called GLUT1. So GLUT1 means glucose transporter type 1. So this is the glucose molecule here, the hexagon, and it will pass through into the brain. This is an astrocyte. So astro means like a star, cyte means cell. Astrocytes are by far the most common cell in the brain, approximately 10 times more common than neurons. And the astrocytes also will have GLUT1, glucose type 1, glucose transporters on their cell membrane to bring glucose into the cell. Now here is the neuron. Neuron is a rather unusual cell. It has a cell body up here, and there's the DNA in the nucleus. Then it'll have an axon, like a projectile extension from itself, and it'll have a synapse. And a synapse is where, this is the presynaptic neuron up here. It makes a neurotransmitter. Neurotransmitter will diffuse across the synaptic cleft and go to the postsynaptic neuron. If it's an excitatory neurotransmitter like glutamate, it will excite the postsynaptic neuron and make the postsynaptic neuron thus more likely to fire an action potential. Okay. Now the astrocyte has a little foot process that also covers up part of the synapse, and it's related to, it will take up that neurotransmitter after it's exerted its effect and sort of recycle it and send it back to the presynaptic neuron. So having three cells here, presynaptic neuron, postsynaptic neuron, and the astrocyte, is called a tripartite synapse. Pretty classical anatomy. The way to think of an astrocyte is it's kind of like the mother, the big mama for the neurons. It cleans up after them. It stores glycogen to provide them with energy in the setting if there's hypoglycemia. It also does other things to help feed the neurons, if you will, that we don't need to get into all that stuff, but just so you know, the astrocytes are super important. But the big reason for showing this slide is So we talked about glucose type 1 transporters to bring glucose into the brain, and they are not dependent on insulin. They just will let glucose in, okay? And then we've got glucose type 3. GLUT3s are the green glucose transporters here. Those also are not dependent on insulin. As a matter of fact, their rate of uptake for glucose can be related to opening up of a glutamate channel on the postsynaptic membrane called the NMDA receptor. And that means that when the neuron is active, it'll want to take up more glucose. But the real key thing about this whole picture, the most important thing on this page, this is what you want to remember, the take-home message, is glucose type 4 transporters. They are present on these neurons. Glucose type 4 transporters are insulin dependent. And they're really like an extra way to get more glucose into these neurons when they're very metabolically active. So the neuron has a way to ramp up its glucose intake so it can be really active when it's doing something intense and busy, which could be learning, could be reading, could be some other activity. But this is a key point. There is insulin-dependent glucose uptake in brain cells, especially in the memory center, your hippocampus. And that's why insulin resistance that will cause an inability of GLUT4s to be translocated up to the plasma membrane, like in the skeletal muscle. That's the beginning of insulin resistance with diabetes. The same thing is happening in these brain cells. These GLUT4s, normally they're stored in a vesicle in the cytoplasm of the neuron, and then they have to be transported up to the plasma membrane once insulin binds to an insulin receptor. Let's say there was an insulin receptor here. I should have drawn one, I forgot. Okay, then the glucose type 4 transporter goes up to the plasma membrane like a vesicle, and it fuses with the plasma membrane, merges with the plasma membrane, and now allows glucose to be taken up by the neuron. That extra boost in glucose amount helps the neuron to function adequately. It enables the neuron to remember things. Neurons remembering something is called LTP, long-term potentiation, and it requires energy, okay? And they get that extra energy from the GLUT4. So when you've got insulin resistance due to eating a high-fat diet, which causes insulin resistance, high-fat diets cause insulin resistance. High-fat diets cause diabetes, okay? I've given a whole bunch of lectures on that previously. That's an important thing to know. Tons of people have diabetes and they're too lazy and ignorant. They never read about their disease. Their doctor doesn't know, so they never avoid fat and they never get better. Okay, but the audience for this YouTube channel, the well-informed crowd, they know that high-fat diet causes insulin resistance, causing diabetes, okay? And it not only is going to cause a metabolic problem throughout the rest of your body, it's also going to decrease cognitive function because it's going to cause insulin resistance to the GLUT4s in the brain. That's a real key point. Okay, the brain's the most hypermetabolic tissue in the body. It only weighs about 3 pounds, so that's about 2% of a body weight of a 150-pound person. It uses 20% of the oxygen. If you look at a PET scan, which shows glucose uptake, the brain's by far the most metabolic thing in the whole body. Not even a close second usually, but a second place thing would be the left ventricle of the heart, which beats continuously, of course. Neurons use about 10 times more oxygen than astrocytes, but astrocytes are 10 times more common. Neurons need lots of oxygen and lots of glucose, and especially CA1 in your hippocampus memory center. Neurons typically use about 2/3 of their energy to make ATP to run the potassium-sodium ATPase. They have to maintain those membrane electrochemical gradients because that's what they use to fire action potentials. That's how they communicate. That's how they send messages to the rest of the body. Now here's an interesting little fact. The insulin-degrading enzyme, which removes insulin from the blood, also removes amyloid. If you have hyperinsulinemia, such that the insulin-degrading enzyme is taken up, there's limited quantities of it, there will be less available to remove amyloid. And that is one of the theories for how amyloid accumulates in the brain, beta amyloid. Now, don't get me wrong. I don't think that beta amyloid is the main mechanism of cognitive impairment with Alzheimer's, but a lot of people do. But, dementia, its mechanisms of causation are multifactorial. So that's one thing you will hear, and it's worth knowing about. The enzyme to clear insulin also clears amyloid, and when it's tied up with high levels of insulin that you get with insulin resistance, then you're less able to remove amyloid, and that is thought by some people to predispose to Alzheimer's. Okay, the brain, we talked about having areas of GLUT4s, insulin and the resistance in the body, being associated with insulin resistance in the brain. Insulin, under normal circumstances has a beneficial effect on the hippocampal brain cells. It increases their likelihood of forming dendrites. Those are little projections that communicate with other neurons, forming more connections with other neurons. That's how you get smarter. You're able to associate more things. The brain cells do not burn fat well. We'll talk about that more in a second. And the big thing is that atherosclerosis from hypertension and from diabetes, they will thicken the basement membrane at the blood-brain barrier, and they will make it harder to get oxygen to your neurons, harder to get glucose to your neurons, and that's a major problem. Okay? And then also we previously talked about excitotoxicity and all that, so we won't go into that today. Okay, hippocampus. Oh, here's a quick question for you about neuroscience. What neuroscience center has the fattest students? The hippocampus. Okay. The hippocampus is the memory center of the brain. The hippocampus has a very, very, very high metabolic rate. It's like a fast twitch muscle. Constantly you're reading, you're thinking, you're learning new things, you're having conversations. Okay, it needs to turn energy production on and off very fast. Glucose burns faster than fat. So glucose is by far 1,000 times preferred by the hippocampus compared to fat. That's an important point. Your brain wants to burn carbohydrate. It wants to burn glucose. The hippocampus is very sensitive to oxygen and glucose deprivation, OGD. Hippocampal neurons often die first. So if a person is hypoxic, has less oxygen available, or they're hypoglycemic, less glucose available, they can really damage their hippocampus rather rapidly. And that can lead to cognitive impairment and even dementia, especially if it's recurrent. To protect the hippocampus, you need to maintain good oxygen and glucose delivery to the hippocampus. Another thing that was interesting is acute glucose administration, IV or PO by mouth, PRAS, improves cognitive function and athletic performance. Now, I saw a video by this guy, Durian Ryder. He's like a long-distance bicycle racer competitor, and he eats really tons of fruits, real plant-based, a lot of sweets even. I think plant-based sweets. And the reason I mention him is he gives videos. He's kind of a funny guy. He's real skinny. Looks like he's in fantastic physical shape, and he trains people. He has all these like skinny, pretty girlfriends who he says he got to lose weight. And he's rather entertaining to watch. He kind of goes on and on and on, but he is entertaining to watch. He's funny. And anyways, he keeps saying the best supplement you could take to increase athletic performance is sucrose. And he says because that's a nutrient burned by your cells. So anyways, I thought he was entertaining and he has a point. Okay, next thing, brain insulin resistance. I'm not recommending everything he says. I haven't watched all his videos. I just watched a couple of his videos, but they were enjoyable and entertaining. And he certainly looks good, and his ladies he's trained look pretty good too. Okay, brain insulin resistance is associated with worse cognitive performance. We talked about you'll get a decrease in long-term potentiation memory at CA1 synapses in the hippocampus. Higher hemoglobin A1C levels are associated with worse cognitive performance. So the less a person has their diabetes in control, tends to be the worse their cognitive performance. And it's also raised the point of something called the mind span. How long do you have good cognitive function in your life? You've heard now, lifespan is how long you live. Health span is how long you are healthy in your life, until what point. And mind span is how long you have good cognitive performance. And I know because I read tons of books and I've seen a lot of authors. They're real clever and funny when they're in their 50s, even up to almost to 60. And then they just like fall off a cliff. They stink in their 60s. They're no longer clever and funny. And I think that's what's happened is they're not perfusing their brains well and they no longer can write well. Okay, a little bit on hypertension. Pressure goes way too high, off the charts. You can get a brain bleed. A big brain bleed is really rare. Patients often die from that, but that's really rare. Whereas moderately high blood pressure, let's say 170 to 200, pretty high risk for cerebral microbleeds. I see tons of cerebral microbleeds every day. These are little punctate, about 3-4 millimeters in diameter spots of old blood, old tiny hemorrhages in the brain. And they're not good for cognitive performance. The person starts accumulating those, their cognitive performance starts going down. When you see a whole bunch of them in the periphery of the brain, that's called cerebral amyloid angiopathy, and it's associated with Alzheimer's, theoretically. Versus when you see them more centrally in the brain, that's characteristic of hypertension. It's called hypertensive encephalopathy. By the way, all the time I see mixed patterns, peripheral and central, and we don't know what causes it, and I think it's due to hypertension. And the same patients who get both the peripheral and the central bleeds, microbleeds, they also get have a tendency to get hemorrhages in their eye, hypertensive retinopathy. So I think it's pretty much mostly hypertension related. Okay, pressure only a little bit too high. You're still going to get atherosclerosis. Hypertension predisposes to atherosclerosis at the bifurcations. It damages the median divider at bifurcation points. And the point I'm getting at is it's going to thicken the wall. So you're going to double up, thicken your wall of your blood-brain barrier, either to protect the artery from hypertension or because of microvascular disease and advanced glycation end products with diabetes. Either way, as that basement membrane wall gets thicker, it's harder to exchange oxygen and glucose through it. So impairment in oxygen delivery in particular is going to predispose you to losing your hippocampal neurons and losing, not being able to have as good a cognitive function. You prevent it, we've talked about it, low-fat, low-sodium, plant-based diet. Okay, a little bit on type 2 diabetes. It'll typically progress, as we've covered in multiple previous lectures, from the skeletal muscle to the liver, the fat accumulation, then in the pancreas, and you lose your pancreas beta cells. And I see fatty atrophy in the pancreas all the time in diabetic patients on CAT scans of the abdomen. But the big thing for our purposes here is diabetes has a big time microvascular disease, plugging up small arteries everywhere in the body. And just like they lose all the little arteries in their foot, they're losing arteries in their brain. You know, in fact, neurologists I've talked to will tell you the 3 most common causes of stroke. There are different types of stroke: diabetes, high blood pressure, and atrial fibrillation. Okay? So atrial fibrillation is a big embolus, big stroke. But in terms of all the little tiny strokes I see all day long, most common thing is hypertension. Second most common thing is diabetes. They're both bad. Okay, let's see. And by the way, when I think of a person who's got cognitive impairment, you ask any doctor, which patient groups have the worst cognitive function they see? And of course, we all know about stroke patient and demented patients. But outside of stroke and demented patients, what categories of patients are most routinely, significantly, obviously cognitively impaired? Number 1, diabetes, because diabetes is so common. It's like normal aging in America that patients are diabetic after 50, especially after 60. It's so common it's not even funny. Okay, dialysis patients, a lot of them have very poor cognitive function. Obstructive sleep apnea patients, a lot of them have, we call it OSA, obstructive sleep apnea. Lots of them have very poor cognitive function. We talked about them dropping their SATs at night. Okay, how do you prevent it? Same old thing. The way you prevent diabetes is minimize your dietary fat. There it is. That's the most important thing by far. Yes, it helps to exercise. Yes, of course, it helps to eat a plant-based diet, to lower your sodium. Those things all help. Diabetics routinely have mild to moderate kidney failure. The kidney's job is to excrete nitrogen, so that's another thing. You want to lower your protein intake, which means avoiding meat. The best way to lower protein is eat a lot of starches, fruits, and vegetables. Okay. Blood-brain barrier. Now, the pericytes are these little contractile cells on the blood-brain barrier to help it regulate the amount of blood flow through it. They can guide blood by constricting an artery. You decrease the blood flow through it. Astrocytes, we talked about them, taking up their glucose through glucose type 1 transporters that are not insulin dependent. Only the GLUT4s are insulin dependent in the brain. Astrocytes can store some glycogen as an energy reserve in the setting of hypoglycemia to protect the neuron. High-fat diet increases blood-brain barrier permeability. That's another thing. The fats, for example, there's plenty of studies on palmitic acid, palmitate, most common sat fat, damaging the blood-brain barrier, increasing blood-brain barrier permeability. Diabetes thickening the basement membrane related to the blood-brain barrier. Hypertension also thickening the blood-brain barrier. Both of those things predisposing to hypoxia, lack of oxygen delivery. High-fat diet itself, sticking all the red blood cells together with rouleau formation, blood sludge effect, so to speak. That's dropping oxygen to the tissues. When you drop oxygen to the tissues, now you're dropping oxygen. That neuron has its metabolic demand, which can be ramped up with stimulants, of course. And if it doesn't get enough oxygen and glucose relative to its metabolic demand, that neuron dies. It goes into apoptosis. You also, when you're damaging your blood-brain barrier from a high-fat diet or from other things, you increase your risk of other neurological problems. There's a good reason for the blood-brain barrier. You want it intact. Okay, so this is just briefly going back to our picture to review these key things. Blood-brain barrier, glucose type 1 transporters, glucose type 3 transporters as being the main supply of glucose to the neuron, but the neuron having glucose type 4 transporters. The GLUT4s are the only ones that are insulin dependent, so it can ramp up glucose uptake when it's real busy, like learning something, reading, or doing some other focused activity. So here's your glucose type 1 transporters. We talked about them. A little more on the details if anyone cares about astrocyte and neuron metabolism and energy production. Okay, glucose type 4, they're the same ones like you see in the skeletal muscle and the fat tissue, adipose tissue. In the brain, they're especially important for the hippocampus. They're also related to the hypothalamus for regulation of blood glucose level, and they're in some other areas too. But the hippocampus is the key thing for becoming demented. And guess what? That's the key thing for Alzheimer's. So in other lectures I've talked about, I think the whole diagnosis of Alzheimer's, I would just call it dementia. Dementia is the key thing to know. Glucose type 4 transporters get more glucose into the brain when it needs it for times of high energy demand. This is one paper, had a lot of useful information in it. There's so many papers on this, I wanted to read them all. I always read at least one, usually 2 or sometimes 3 papers, and they're long papers while I sit there eating dinner. I'm making myself do that at dinner, and so I'm getting through a lot of these papers. I find it interesting. Okay, a couple points why the brain does not want to burn fat. Because, first of all, fat drops oxygen delivery. In the rouleau formation, sticking the RBCs together, you can't get oxygen to the tissues fast. It drops it, let's say, by about 15%. Then, to burn fat by beta oxidation, if you look at a beta oxidation of a fatty acid, you're oxidizing it. It means you're sticking another oxygen on it. It ends up taking 15% more oxygen in order to burn a fat than it does to burn a glucose. Look at a molecule of glucose. You see a whole bunch of hydroxy groups all over the place. There's lots of oxygen already. And you're already halfway oxidized. Whereas with the fatty acid, you just got a bunch of carbons and hydrogens on the whole methyl end, the whole fatty acid carbon-hydrogen tail. So you need tons of oxygen to oxidize all that, meaning that you need lots of oxygen. Well, the brain doesn't have that much more oxygen to spare. And we know when you eat fat, and if you try to burn fat in your skeletal muscle, it makes electron transport go backwards. And it generates a lot, dropping down electrons to oxygen, producing superoxide anions. It causes electron transport reversal, and it causes oxidative stress through production of those superoxide anions like we have drawn here. So the little dot right there means free radical, meaning unpaired electron in its outer orbital. And it has a negative charge on it, and that's a superoxide anion, and that's what's produced when one electron is added to regular oxygen. There's tons of PUFAs in the intermitochondrial membrane in every cell, plus there's lots of PUFAs in the plasma membranes of neurons, all the DHA and EPA and all that. They're permanent cells. For all your life, they remember your memories from childhood, so you don't want to be damaging them. But the brain itself is in particular highly vulnerable to lipid peroxidation. Surprisingly, the brain has a relatively weak antioxidant system, about 50 times less catalase than liver cells. That's a surprise. NEFAs are non-esterified fatty acids, and they can behave like protonophores and actually pop holes into the intermitochondrial membrane, which will cause leakage of protons. And while that decreases energy production, it actually does protect a little bit from reactive oxygens because it lowers the intermitochondrial membrane gradient. So I know I'm getting in a little bit of fancy biochemistry there, but what I'm basically saying here in fancy medical words is fat is bad, fat is bad, fat is bad for your brain. Okay, that's why I try to keep my dietary fat as minimal as possible. All this stuff about good fats, I think that's like a word to hypnotize people and make them think that there's like all kinds of good fats to see. In my whole life, I've been a doctor a little bit over 30 years. I've never once ever heard of or seen a patient with a fat deficiency. I've never seen it. Nowadays that they sell omega-3s, I'm hearing them talk, measure your levels, measure your ratios. I've never heard or seen that to be useful. Yeah, I could study it some more, but it sounds to me like a lot of advertising hype. Energy is made twice as slow, so it's slow when you get it from fat. That's another thing. These cells got to be on, off really fast, the hippocampal memory cells. We're constantly learning and interacting with environments, and it's analyzing them, deciding to memorize, not memorize. And so the beta oxidation is just too slow for a busy brain. That's another reason why it's not going to work. So the point I'm making is fat is bad for you because it causes insulin resistance and it causes diabetes. And your brain can't use it anyways, and it disrupts your blood-brain barrier, causing inflammation and other problems for your brain. So there's nothing good about it, okay? And you get enough omega-3s just from eating plant foods. There's plenty of them. In previous lectures, I went through all that. Okay, now here's a good article. If you want to see a really good article about why the brain does not burn fat, this paper by Reiser, Why Does Brain Metabolism Not Favor Burning Fatty Acids for Energy? Good paper. We're almost done here. Just a little bit more on this stuff. I think it's pretty interesting to understand how the brain works. What's the significance of hippocampal atrophy? You're cognitively impaired when you lose your hippocampal function. Okay, metabolic demand. If a neuron doesn't get its metabolic demand met with oxygen and glucose, a neuron will often die, especially when that's chronic and repeated. What's the difference between a liver cell and a brain cell? Well, you need your brain cells your whole life, so they don't regenerate. You just have them. Whereas a liver, you got all these like liver stem cells. If you lose a little bit of your liver, it'll grow back. Another pretty good paper, Glucose Transporters in Brain Health and Disease. So basically, diabetes, it makes you stupid. It impairs your cognitive function. It accelerates your pace towards death. And if you go low-fat vegan, you can cure it if you catch it in the first couple of years, typically. But once you've had it, more than 4 years, it's quite variable, and you'll have lost a certain number of beta cells if you can ever cure it. Talking about type 2. Okay, traumatic brain injury. These are just other ways that neurons get injured, more things that they have to compensate for. But what I'm basically saying here is when a person eats a high-fat diet, they're really making life bad for their hippocampal brain neurons. Because the hippocampal neurons in the first place, they can't burn fat because fat doesn't work. We just talked about that in the previous slide. It's too slow, requires too much oxygen, so they can't burn fat. But guess what? Now because they've got insulin resistance due to the fat, they can't take up as much glucose as they want. So you see how the hippocampal neuron is screwed? It's almost impossible to be intelligent if you're diabetic because the neuron can't get enough glucose, and so it's starving. It doesn't matter if you just ate a giant meal. If you've got the insulin resistance, your neuron is starving. It can't get the glucose that it needs to function at optimal. Now, don't get me wrong. I know some smart diabetics. I know some doctors who are diabetic who've done a good job managing it, but they're very careful about their diets, and that's enabled them to perform very well intellectually and to work. But the vast majority of diabetics I talk to are cognitively impaired. They're mentally slow. They don't have insight into their problem. That's why they never get better. And I can also tell you, I know a lot of people who should know better that think that a low-carb diet is the way to recommend for a diabetic. It's quite frankly, that's completely stupid. If you've studied diabetes a while, you'll see. Just look at Shellman's paper, Brownlee's paper. It's pretty obvious. There's tons of stuff that's been written and said about it, that high dietary fat is what causes insulin resistance leading to diabetes. Okay, other risk factors for dementia. Well, gee, they're all vascular risk factors: obesity, hypertension, high cholesterol, diabetes, which kind of implies that Alzheimer's itself is probably a vascular disease, which I think it primarily is, although, of course, it's multifactorial. And the big thing, we talked about losing the hippocampal cells in the CA1 area, cornua amnis 1. It comes from Ammon's horn, the old story. Okay, CA1, very, very sensitive to oxygen and glucose. And guess what? It's also very sensitive to excitotoxicity. That means when you eat stimulants like caffeine, other brain stimulants, nicotine, psychological stress, lack of sleep. There's some medication stimulants. There's other things. You don't want to be overstimulating your hippocampus, giving it more work to do than it needs already. And then we talk about all that chronic thickening of the basement membrane from diabetes and hypertension, making it harder to get oxygen to that hippocampus. So you can see your older person who's accumulating atherosclerosis and thickened basement membrane of their blood-brain barrier, they're really at high risk to become demented the worse they allow that to get. Okay, and then they're just going to have a hard time ever functioning well cognitively. And here's an interesting paper, Hypothesis for Alzheimer's Disease Lipid Invasion Model. So this guy wrote an entire paper showing how high-fat diet just destroys the brain. And do I think he's exaggerating? Yeah, I do think he's exaggerating a little bit. I don't think it's that solid, his whole rationing, his whole reasoning process. But he still makes some very good points. And the fact you can do that. Okay, no one could say glucose isn't good for the brain. Everybody knows the brain wants glucose. You improve performance having a good blood glucose level, okay? But This guy can put together a whole paper systematically showing all the bad things that fat does to the brain. I thought it was actually an enjoyable, interesting, intelligent paper. Okay, bad blood flow to the brain. We know that high fat makes blood flow bad. Sodium is a vasoconstrictor and inhibits nitric oxide endothelial. Low potassium and magnesium in meat and processed food. Okay, here's just showing the structure of a fatty acid. This is the carboxyl acid component, so this is the carboxyl group, also called a carbonyl group, and that's the carboxyl carbon. That's worth knowing. Here's the alpha carbon, and here's the beta carbon. So when a person undergoes beta oxidation, they're cleaving right in there. Oh, I hope you were able to see that. I was looking at the other picture. They're going to cleave right between the alpha carbon here and the beta carbon. So here's carboxyl carbon, alpha carbon, beta carbon. Beta oxidation cuts right here and then sticks an oxygen on here. And because it keeps sticking oxygens on there, you need a lot more oxygen to run beta oxidation of a fatty acid than you do from metabolizing a glucose. Okay, this is just a slide showing that the fatty acids cross right across the plasma membrane in skeletal muscle cells, and they do so in a lot of other locations. So there's no way to really control them other than to minimize your dietary intake of them. This is just showing normal electron transport. The electrons are passed by two progressively more aggressive, more electronegative grabbers of electrons. So from complex 1 through complex 2, well, actually it doesn't go directly through complex 2. It goes to coenzyme Q, to complex 3, cytochrome C, and then to complex 4. Then that hangs on to oxygen. Oxygen is the ultimate electron acceptor, and it's converted into H2O, to water. You're generating a proton gradient here, which can be harvested by ATP synthase, which is also called complex 5, and that lets a proton come back in, and that provides energy for the movement that will add a phosphate to ADP to make ATP. If you eat tons of fat, this will back up here. The inner mitochondrial membrane gradient will get too high, really because you're making too many FADH2s. But the point being is you'll end up dropping an electron down onto oxygen to turn it into a free radical, create superoxide. Ideally, you'll just quench it with superoxide dismutase, but we're not going to focus on that right now. Just briefly, we talked about this in a previous lecture just a couple days ago, how superoxide, normally you'll quench it into water, but when there's an excessively large amount of them, you can end up with a series of reactions leading to hydroxyl radical and then lipid peroxidation of the mitochondrial membrane. A couple of directions you can get there from, and that's bad. You trash your mitochondrial membrane, you trash a couple of them, and the cell might go into programmed cell death, apoptosis. So I'm just saying, fat is trashing your membranes, making you stupid, making you fat, giving you diabetes, giving you hypertension. I don't think there's any good fats to seek out. You get enough fat from just eating plant foods. You don't need to seek them out at all. Okay, so this is just a summary diagram. We already talked about the astrocyte having GLUT1s, like the blood-brain barrier having GLUT1, glucose transporters that are not insulin dependent. The neuron getting a lot of its glucose from GLUT3s that are not insulin dependent, but having GLUT4s that are insulin dependent for getting that extra kick to provide optimal cognitive function. And losing your GLUT4 function puts you on the highway to dementia. Okay, these are just some of the references, a lot of papers. Okay, so some of the papers here. The McNay paper I thought was really good. And here's just some more papers. So anyways, the bottom line is your brain doesn't like fat, doesn't help your brain. So you want to minimize dietary fat to have long-term good cognitive function and minimize your risk of getting diabetes or hypertension. Okay, so hope that was helpful.